Thanks again. My name is Dr. Bittar, and I'm with the College of Veterinary Medicine of University of Florida. And it's a pleasure to join the South Florida Beef and Forage program. And today, within the all several of diseases of importance for cattle, we're going to talk about anaplasmosis. So there was interest from several producers about it, and that's a disease that it's good to learn a little bit more on this time of summer, because we're going to have more of the vectors of this disease replicating now, and then in few months from now, we're going to have possibility of bringing cattle to the herd. I mean bulls, especially if they breeding bulls are importing from different places, and that's a risk for this disease. So what we're going to talk today here in summary is about what the disease is and why we care about it, how this anaplasmosis is transmitted, how to identify one infected animal, and then how to treat, prevent, and then hopefully you're going to have time for questions. So what it is, what is it, and why do you care? So anaplasmosis is a disease caused by a bacterium called Anaplasma marginale, and they must infect the blood of the cattle. So the Anaplasma marginale, as you can see here, they have this name because when you stain them, the inclusion bodies goes on the border, on the margin of the red blood cells. And these species can infect cattle, bisons, and deers. And they are one of the number one source cause of anemia in cattle. They can cause abortion, and in adult animals, they can cause the death of those animals. That's an important outcome that the producer don't want to have it. And then if those cattle, the younger cattle especially, go through the disease and then develop some immunity, they become poor doers. They might not gain weight well or reproduce as we're expecting. And they also are the carriers. So they always have this bacterium that can be transmitted to the other cattle. And it's the number one disease caused by chicks in the U.S. So how is it transmitted? So the major transmission way is by biting insects. So when those insects, in this case chicks, are the most important ones, they get infected red blood cells or infected blood from an infected animal or a carrier, and they transmit to susceptible animals. So those animals that don't have immunity. So usually the chicks called dermacentor species are the one that transmit them. So what happened? This chick go and bites the cattle, and then the red blood cells infected with anaplasma goes to the gut of the chick, in which the Anaplasma marginale is able to survive and stay in the salivary glands. So whenever this chick bite another animal, then it's going to transmit this Anaplasma marginale for the susceptible cattle. The other ways to transmit the disease is through what we call mechanical vectors. In this way, the biting flies are the most important ones. And the ones that are going to transmit are the ones that have long mouth, the ones that are able to bite the cattle and go through the skin. And in this case, you have the horse flies, and then the stable flies are the more important ones. But they are mechanical. The Anaplasma marginale does not continues their cycle on them. They are just just transmit infected blood from the infected animal to the susceptible animal. The horned flies I put over here because there is no the researchers and the clinicians believe they don't transmit the anaplasmosis uh, in, but there's no proof, so it's kind of out there. But the horse flies and the stable flies are the major biting flies. And the other series of mechanical vectors that very important, very common for us and for the producers are the fomites and equipment. Any equipment that we use that share blood are able to transmit anaplasmosis. So you can see here this cow was dehorned here. There's blood there. So you're castrating a bull if there's blood and they are not disinfecting the knives or the castration knives. If they're shedding needles, syringes, tagging pliers, ear notchers, tattoo devices, the horn device, as we said, hormone implant devices, IV hoses or IV sets if they are treating intravenously some animals, and then they share those hoses or IV sets without proper disinfection, you can transmit anaplasmosis. So, and also reproductive devices, if they are not disinfected, you can iatrogenic, so a person can transmit that bacterium. So anything that shares blood, uh, it's a mechanical vector. That's very important to understand because that's a way to control the transmission. You can, if you know that a herd is positive for anaplasmosis, and then if you need the ranchers or the cowboys need to use any of those equipments, it's very important to do the proper disinfection in between animals. So there's important information here that they have a relatively long incubation period, about 3 weeks to 6 to 7 weeks. What incubation period? So incubation period is the period from when the animal was infected first until they develop the first clinical signs. So usually, let's say this chick here, it's been in this animal for a few days, I would say, because it's already engorged, so that they're sucking blood. So this chick is big. So, but let's say this chick got this steer here today. So then within 3 weeks to 7 weeks, then we're gonna see those first clinical signs of anaplasmosis on this animal. So what means is if the producer castrated, like I say, a bunch of bull calves and they were infected and they shared the same knife and didn't disinfect it, so that event happened at least 3 or 4 weeks before, then those animals are going to show clinical signs of the diseases. And the initial appearance of the clinical signs is about 1% of the red blood cells are infected, are destroyed actually. And just a note that the red blood cells of cattle, they're going to double in numbers every 7 to 10 days. So at peak of the infection, the animal may have 50 to 70% of the infected red blood cells. And that's not a good thing because those red blood cells, they need to transport oxygen and CO2 to the animal. So if they get destroyed, then they're going to have impact on this oxygenation of the tissues. So there's an important word, like a word here that made scared some people, but don't don't worry. This is just saying that those infected blood cells that they are destroyed in the spleen and the liver. So they are not destroyed in the blood vessels. Therefore, you might not see a red urine on those infected animals. You might see a little bit dark, but that's not common as we see in other diseases. That's what we call hemoglobinuria. So that's blood in the urine. So with anaplasmosis, we usually don't see that. Okay, so the animal was infected. Maybe it was a cheek or a sharing of a contaminated equipment, and then what's happened. So usually the younger animals, they have some level of resistance. So the calves or the yearlings, usually the infection is going to be subclinical or asymptomatic. So you barely not going to see those animals showing some diseases. So you may see an animal that's a little bit lethargic, no, is a little bit depressed. If you are driving a herd of cattle, that might be that calf that stay on the back, in the behind. If you are feeding cattle very frequently, and if you are used to, you may see a little bit change of a behavior. Maybe an animal gets a little bit depressed or down or slow, but that's not much. Maybe a calf eats less, but that's going to be for 1 or 2 days. So you're not going to see too much on the younger animals. When you go to the a little bit older categories, yearlings or 2 years old, then you might might see a little bit more of clinical signs. You can see fever, so usually from 103 to 106 degrees Fahrenheit. They may be breathing hard, so kind of tough because in Florida, when the summertime, when the temperature is high, humidity is high, that might be a heat stress sign as well, but that's so similar that they may have a moderate anemia or maybe severe if it is an older animal. If there's a large degree of infection, they may lose appetite, so they might stop eating as the other compared to the other animals. Therefore, the rumen might stop working or will work a little bit slow. So if you are paying more attention, you may see that left flank of the animal more deep. It's not full like you see here in these animals, very full. You're gonna see more like in this animal here, even though it's the right side, but you can see the flank, the paralumbar fossa, kind of very deep, depressed, so that doesn't have too much on the stomach. And it may cause death on those young animals, but that's not the common. The important here is the adult. So that's where we're going to have to pay more attention because it's going to. Those are the animals that if they are naive, they never never were infected with anaplasmosis, then they are more susceptible. So they can get severe clinical signs such as fever. They stop eating and they're gonna lose weight really quick. In few days, you're gonna see animal kind of shrink. You're gonna see their pale membrane mucosas, so in jaundice, so it's kind of yellowish. When you go in their eye or in the mouth, or if it's a cow, if you go in their vulva and open their lips, you're gonna see more yellow than pink. The rumen stop working because they stop eating. They have constipation with dry feces. You can see here, that's not a good picture, my apologies, but you can see the rings on the feces. And then you're gonna see kind of those feces coated with some mucus. So that's kind of, it's not a specific sign for anaplasmosis, but that's specific that the rumen is not working well. Then you can see easily the cows or the bulls or the adult animals being weak and staggering. They may be open mouth breathing. Why? Because they don't have adequate oxygenation in the brain. So then there's less red blood cells carrying the blood, carrying oxygen and CO2 back and forth. So then you may see some neurological signs, maybe animal that's okay. If the producer knows it's not too aggressive, it may become aggressive. I'm not talking about those Brahmans, Bosniacus cows. They might be a little bit more temperamental than others, but if you know your cattle well, you may know when a cow is friendly or not. And that's very important because there's a lot of other disease that can be in the differential diagnosis. And it can cause abortion on the pregnant cow. And the cow that's lactating can become dry. Therefore, there might not be enough milk for the calf. And then it's fatal. So the animals can die. That's a common it's one differential of what we call common death, sudden death. So herd is good. Apparently, suddenly you see a dead cow the next day that you go in the pasture. So the anaplasmosis might be one of those diseases that you can include on the differential. So just a little bit more on the details of what the clinical signs. So the PCV is the packed cell volume. So that's the volume of the red blood cells that we usually measure. And then whenever it's 12 to 25%, then it's when you're going to see the first signs of a severe anemia. So that's a severe anemia. And then if this percentage decreases to 12% or less, then the animal will die. That's very important. And then here, so it's just a cow. It's not a sick cow here. When you go and zoom and open the lips of the vulva, it's not pink as you used to. So it's the yellow that we call jaundice. So that's kind of severe of a sign of anemia. That's very important. If it is on the male and the bull, then you may have to go to the eye and check the mouth to see those mucosas. And then when you see the anemia, when it's detected, it means that almost half of the remaining blood cells are infected and they will be destroyed. So that's kind of bad because the animal is going to have more difficulty in oxygenation of the body overall. Usually total protein is normal. And what I'm saying here, because this is an easy test you do, you just bleed the calf, the cow, and get that the blood to clot, and then you get the serum and put in this refractometer in this device, and you can measure. So there's a correlation about the density, but usually in the dairies they use this quite a bit to check total proteins on the calves. But anyways, so you have the clinical signs, and then you have to use as well some laboratory diagnosis. So in this graph here is just a percentage, and then we have three variables here. So the PCV, the packed cell volume, that's the red blood cells percentage. Then you have the pericythemia, so that's the amount of Anaplasma marginale in the blood. And then we have the clinical signs here in red or the square. So if this cow read the book well, then remember I say the incubation period will be about 21 days. So the cow got infected here, day 1. Then about 21 days, you don't see too much Anaplasma marginalis in the blood. And then the red blood cells volume, PCV is okay. Then it starts decreasing suddenly. And then whenever you have like that threshold of PCV of 20, 25%, then it's when you start seeing the clinical signs. So the bacteria grows too quick, and then we say here that's the acute, and then after that, if the animal survives, then it creates some immunity and the levels goes down, but doesn't go zero. So these animals will be carrier. So in the acute infection, we can do a blood smear to identify those bacteriums. That's the red blood cells here that we stain. So those dark dots on the margin of the red blood cells is the Anaplasma marginale. And then you can use this test here, the blood smear, just on the acute infection. So about 22 days after the animal was infected to 29, 30 days or so. And you can use the PCR. That's a genetic test that determines the genetic material of the anaplasma as well. But that's a very shortened window to detect. And most of the times, you need to do the diagnosis, but start treating. You may not wait the results to come to start treating. So if the animal pass that acute infection, like let's say 29, 30 days, as I was telling, then the animal becomes carriers. And to identify those, we use different tests. We can use PCR as well. That's a more advanced and more expensive, but it's better test. But then we can do serology. So serology is the serum. When you get the blood, you let it clot, and then you just get that yellow liquid part and send out to the lab. And you can do ELISA and complement fixation. You don't need to understand that, but what you need to at least think about is one test has a higher sensitivity. So it's better to identify the true positive one, positive animals, that's sensitivity, than the other test. And PCR has a good sensitivity and good specificity as well. Specificity is it's the characteristic of the test to identify the true negative ones, whoever doesn't have the disease. So, and then this ELISA and PCR you can do for lifetime. So you can use after some treatments are applied to see if those animals cleared or not the infection. That's harder to clear actually. So just information here. Bronson Animal Disease Diagnosis Laboratory in Kissimmee, that's the state lab. They offer two tests for Anaplasma marginalis, so the PCR and the ELISA, that's for detection of antibodies. And those are the price. So PCR is a little bit more expensive, but it's a test that can bring more information if you need it, if you could not do that blood smear. And that's a turnaround time. So the PCR takes 2 to 4 days for the lab to bring you the result. And then the ELISA takes 3 to 5 days. And these, remember, the veterinarian are the one that need to submit the sample and request the test. So you need to work, the ranchers need to work with their veterinarians. So, okay, we can treat, right? Yes. Unfortunately, in the United States, we cannot use imidocarb. That's a good to treat anaplasma in babesiosis as well. In South America, in other countries, it can be used, but there are some reports of possibility of induced cancer. And that's why one reason that in the USDA, FDA did not approve. So we cannot use this here in the US. And we can use the tetracyclines or oxytetracyclines. If they are regular ones or long action, then you just need to use in their recommendation, in the manufacturer recommended dose. But usually it's you're gonna treat from 3 to 5 days. And then if it's long action, you can use twice, 3 days apart. So you're gonna handle the cattle less with the long action. These are injectable ones, intramuscular in the vein, intravenous. And then you can use with or without the combination or the oral chlortetracycline. So you can use chlortetracycline hand-fed or free choice formulations like minerals or so. If you are using hand-fed, usually the concentration that you're going to use, it's lower compared to the free choice. The free choice, usually we put higher concentration because there might have a different intake of that feed, therefore that antibiotic by the cattle. And they require long periods from 30 to 60 days and sometimes for 4 months. So you have to feed every day and make sure you have that right concentration to reduce the level of anaplasmosis on the cattle. And there's some research done to try to evaluate different treatments protocols to see if they can clear the anaplasmosis from the cattle, but that's kind of very hard. They don't have much success. So this is the FDA page and some recommendations, and I'm putting this because since 2017, to feed oral chlortetracycline or oral antimicrobial, you need to have a veterinarian prescription because they have the VFD, veterinary feed directive. So every animal that's going to receive that oral chlortetracycline needs to have a prescription for the period that you're going to treat and the concentration as well. So it's kind of become harder to get that in practice. But anyway, so just be aware that you always need to work with your veterinarian and especially if you're gonna use some oral grade antimicrobial. Some animals, they're lose a lot of red blood cells and they do need some blood transfusions, usually 4 to 8 liters, and they may have some supportive care, give some IV fluids, oral fluids, vitamins, electrolytes. But what I want to say here, that's it's kind of hard to do in the beef cattle setting. We see more done in the dairy cattle setting, but we may do this in the beef cattle setting. But what adds another difficult layer here is because those animals, those infected animals, they don't have too much red blood cells. They are already uh, having difficulty to breathe, to oxygenate the brain, the body itself. And then whenever you bring this animal to the chute, you are agitating them. So you're going to increase the risk of their to die. So just kind of, it's a very different, very challenging point sometimes to decide, do I need this animal? Do I handle them, strain them? Or maybe I don't, especially if it's an animal that's creating a range setting, doesn't come to the pen too often. So that's animal that's a little bit more aggressive, doesn't have too much human contact, but you need to weigh that and talk to the veterinarians because the animals can die even if if you're trying to treat them. So important to manage, do some management and to prevent. So as a control, you try to reduce your chicks population, biting flies as well. Sometimes it's kind of challenging in Florida, but those are are the important prevention points that we need to do. Uh, this is relatively easier. Control the iatrogenic blood transmission. So any blood, any equipment that we use and have a potential to transmit blood, let's try to disinfect that. So those castrations knives, dehorners, needles that I told you, and etc. And especially if you know that your herd is positive, has anaplasmosis, so that's when you need to be more severe in implementing those protocols. You can attempt to treat the carriers animals with oxytetracycline. That's not always successful, and now you have to have a veterinary feed directive, so you need to have a prescription from the vet. It's kind of really hard. And then really be careful, and then think about it and talk to the veterinarians, and then to have a plan to whenever you're going to bring naive animals, especially adult ones, into your range or in the areas in which you have a high risk, or infected animals into a naive herd. So I say that because a few years ago we have a severe drought in Texas, so they were kind of selling cows very cheap there. You might be bringing a cow that's infected to your naive herd from Florida, or you might be bringing a naive cow from, I'm not saying only Texas, but that was one example. From Texas, you may be bringing a naive cow, a cow that never encountered Anaplasma marginale to your herd that is infected. So if it is adult cow, there's a high risk of those animals to die. Again, you can feed chlortetracycline over the risk period. So you have the veterinary feed directive required. So you need to have a veterinary prescription. But if you end up bringing adult animals to your herd, then you may be using this strategy here. And then in Florida, it's very known to use bulls for natural service. So we don't use much artificial insemination in the cattle, in the beef cattle. So it's common to bring bulls, to buy bulls to replace the bulls to breed cows. So if you're bringing bulls, again, from areas in which they have anaplasma to your herd that doesn't have, it's a risk. And if it's the opposite, the same thing. So we need to be aware of that and then work as you can. In eradication, so to get rid of the Anaplasma marginale in the herd level is very, very difficult. So therefore, you need to try to control and to work with what we have. Just to try to wrap up in a few slides here. So vaccination, that's a kind of important tool that we have, and it's kind of debated because there is a available acute vaccine made in Louisiana with red blood cells from cows. So you need to you need to vaccinate the cows or the cattle twice and then booster annually. But there's a variable efficacy. So in some animals it works, some doesn't. There's a short rate of immunity. So what it means, you need to be revaccinating more frequently. And there are some issues in calves in which their mothers, their dams were vaccinated. So this isoimmunization, erythrolysis here, those ugly words here, is nothing more than it's kind of blood reaction because from the cow that cause some disease on the calves, because to develop this vaccine here, they need to infect animals and cows or cattle and collect their blood and then isolate the anaplasma. But in that process, sometimes you have some red blood cells from those donors, and those are the ones that are causing this. So what happened? Those calves, they get sick and they die because their mothers were vaccinated with this kind of vaccine, the kill vaccine. This currently requires a state veterinary approvals for use. So there's one more layer. You need to work with your veterinarian and also do the bureaucracy to see if the state veterinarian allows you to use it. And then you have those points here that's it's not a clear cut that's gonna work. There's a live vaccines in which there's a live Anaplasma marginalis that used to make a vaccine from California, but that's just allowed only in California, so it's not allowed in Florida. Maybe in the future there will be more vaccines to be developed with better efficacy. And the other point to add is those Anaplasma marginalis, they have different strains, so there are different types. Maybe this acute vaccine here from Louisiana uses one strain, it's called Mississippi strain, but the Florida one, they have different strains. So there's a level of protection from different strains, but some strains, this level is very low. So that's one justification of this variable efficacy. So with that, I'm going to be open for questions and comments. And this is my email here. If you don't have the chance to answer your question today, please feel free to reach me here at jbittar@ufl.edu. And I'm located in Gainesville, Florida, in the College of Veterinary Medicine. Thank you very much for your time. I will be open for any questions.
Thank you so much, Dr. Bittar. That was an amazing amount of information, and I certainly have a better understanding of anaplasmosis. And we have time for a couple of questions before we move to Dr. Moriel's section. Because we are still a small group, if anyone wants to just unmute themselves and ask questions directly, go for it. You unmute by clicking the little microphone button. It looks like Lauren has a question.
I just found my chat box there.
So Lauren has a question. She says, are there areas of the state that are more susceptible?
All right, thank you for the question. So didn't want to throw too much information there, but that was one that I missed. There was in the past, there was a dogma that was limited to the south of the I-4 interstate, but talking to veterinarians, so we can find in the Panhandle, so it's everywhere because there's a big trend of animals coming in and out of Florida. So in areas in which you have more chicks or flies population, or they grow easy, then there's more risk for that. But right now, I don't have the data. It would be good to talk to Bronson lab if they have some results from Florida, but right now it's not limit for a certain area, Lauren. It's kind of everywhere.
There other questions? Feel free to unmute yourself if you have questions.
So is there natural organic preventive application? There is a question here in the chat privately. I'm not gonna disclosure who is the person, but the question reads, is there a natural or organic preventive application? If I understood it right, it's about application like to prevent or to treat the disease. Anaplasma, as I said, the young stock calves are more resistant. Usually they don't die. And then if they get infected or they get exposed to Anaplasma marginalis when they are younger, then they are going to develop some immunity in which are going to be protecting them when they are adults. Doesn't mean they might not get sick when they are adults, but they don't, the risk of die for or lose too much weight or get very sick when they're adult are reduced. So it's kind of giving a natural vaccination, I would say, when they are young, if you let them get sick. But it's kind of depending on the amount of animals or your setting might be complicated. So